So hello, thank you everyone for being here with us tonight. We've got such an incredible group of minds on stage for this discussion. But before we dive in, I just wanted to tell you a little bit about ustwo. We are a digital product studio, we're global, and for over a decade we've been deeply involved in healthcare, working really across the spectrum from large pharma companies like Eli Lilly and Novo Nordisk to cutting-edge technology with Google DeepMind and digital wellness leaders like Peloton and Calm. Our focus has always been on designing and building meaningful, human-centered solutions that drive impact. And I think we're at a real inflection point in healthcare where AI, personalization, and data-driven insights are converging to redefine how we approach patient care and outcomes. And we'll talk a lot about that tonight. At ustwo, we're creating breakthrough experiences that tackle these challenges head on, from adherence to condition management and more. So I'm excited for tonight's conversation. I hope all of you connect to and continue speaking outside of this. And thank you again for being here. I'll pass it over to Heidi.
I just want to say that this is a great event, ustwo. So thank you so much for organizing this. And the British Consulate has been home for the past almost 2 years. I was head of press, politics, and public affairs, and I ran into this wonderful woman, Amy, who's here tonight with Alpha Kilo in the back, which is a powerhouse. She has clients in the Valley and in London. It's an amazing firm. And she was like, you know, we really need to bring some of this stuff to Boston. And I was like, yes, you do, because 32% of venture capital in America comes into Boston. And I don't think people realize that. And so I'm just so excited to have the talent on stage tonight. And I'm not someone who understands healthcare. A lot of you in the audience do, but I know enough to be maybe dangerous. But I'm going to start by introducing Lynnette, who came in from Barcelona, and Greig, who's here from London and Yorkshire, and Shikha, who's here in Boston with us. We have a really powerful group. And so I'm going to let them explain first what their companies are, what they're doing. I've told them to please promote themselves because they will do a better job explaining what they do than I will. And so I'm going to start by saying, what is the product that you've worked on that you're most excited about? And what features of AI and health are you seeing in these products that you're really excited about? So we'll start with you, Lynnette.
Okay. Well, I guess before I answer this question, I'm very, very happy to be here. Thank you, ustwo, for hosting us here. Very happy. I think I'm going to throw the question to the audience, right? Show of hands, how many of us here know quite a bit about your immune system? Healthcare professionals, people in the field, yeah. How many of us here don't really know so much about your immune system and how it works? Oh, I belong to that bucket too. How many of us don't really care? I think the product that Omniscope is building, we're a startup looking into the immune system in high definition, specifically the adaptive immune system. So then the AI aspect and the science aspect that gets us really excited is then addressing this 2 or 3 different buckets of people, right? And I think for us, we've built a few products now. One of the 2 is our flagship OST. We read 100 T cells per clinical sample. And so with that, you get a very high definition of what your body's actually looking at, what it's responding to, whether it's treatment, whether it's vaccines, and then applying that to the clinical setting. So if you're a clinician, you're a researcher, I'm able to see, well, is that treatment actually working in your patient? Is it not working? Is the vaccines if somebody's taken a vaccine, is it still working after 5 to 6 months? Do you need a booster shot? Right? And then on the second bucket, who don't really know so much about the immune system, we're working with the Football Club Barcelona and working with them to track how athletes are performing pre-season, during season, and post-season.
Okay, so Omniscope is looking at my T cells and they're going to read my immune system.
Exactly.
And I want to come back to this after we hear from Greig and Shikha about Barcelona, because I think using the football club is a very interesting model to explain what you're doing.
Okay.
So Greig, tell us what product, you've made a lot of products over the years. I mean, yes too, but what's one you're really excited about and features that you think would be exciting to all of us?
Cool. Well, firstly, it's lovely to meet you all. I'm the head of design at ustwo. And so I lead a very talented multidisciplinary team of around 50 designers who all operate in the space from research, UX, service design, UI, high motion. So a very broad church of skills, which is exactly what we need when we're actually working on lots and lots of different challenges in terms of building digital products. And some of the digital products that we've been building recently have had a core focus on behaviour change, which is obviously an incredibly important subject within the healthcare space. One of them is a product called Body Coach, and this is founded by someone called Joe Wicks, who is a UK celebrity, maybe not as well known over on the East Coast. Do look him up.
Did you say Joe at that telephone?
Yeah, and so Joe Wicks, he kind of skyrocketed to fame in the UK during the pandemic because he started to offer PE lessons to the whole of the nation. So all of the children would log on to a YouTube channel during the pandemic, and this was their form of exercise over the pandemic. And it just so happened at the same time, we started to develop a product for Joe, which happened to be a fitness and nutrition product, which was really kind of targeted at the mass audience. And it was guiding people on a journey of improving their nutrition, improving their fitness status through tailored fitness programs and recipes that are delivered on a monthly basis, which are tailored to their macronutrient levels as well. And the thing with Joe is that he's obviously kind of, he brings this amazing persona, which to the point around Barcelona Football Club, I think is an incredibly kind of like powerful tool in terms of pulling people through these type of behavior change programs. Another client that we're working with, where we're starting to translate some of the frameworks that we're building out with behavior change, is working with L'Oreal. And so we're building L'Oreal's first ever skin coaching product at this moment. It's just launched the beta into the UK market. And this is targeting a Gen Z audience who are looking to be able to improve their acne. And so often at ustwo, we'll work with specialists in the domain. So we do work with dermatologists very carefully, but then to build out a program that we can then reach the Gen Z audience with to try to improve the efficacy of the products that they're using. Huge amounts of mental health that is associated, negative mental health is associated with skin that is really affecting this Gen Z audience. And so we're building the L'Oreal's first coaching program around this.
So behavioral change using technology.
Yeah.
Okay, Shikha, you're the doctor on the stage. We actually have a doctor on the stage, and
I am the doctor on the stage.
You have done so much in this healthcare space. So don't only tell us the product, can you just tell people a little bit, because the American audience here will know those brands that you've been with.
Sure. So I've worked at a lot of big companies, Aetna, CVS, Walmart. For those of you who are European, I was the chief medical officer of Withings, the French device manufacturer. So I've worked at a bunch of big companies, really with the idea of understanding the system really well at heart. I'm a very small company person, and what I do with most of my time now is work at an early stage startup that focuses on helping day-to-day living for people with chronic lung conditions. First COPD, chronic obstructive pulmonary disease, and going on from there. And what I'm really excited about with Zeph, the product we're building, it's designed for longitudinal behavior change, really thinking about how to take care of yourself and build your exercise tolerance on a day-to-day basis, which is very similar to many other things I've done. But the really exciting part is COPD, for those of you who don't know it well, it's related to kind of what we used to call emphysema, and those things sort of blend together. And it's often people who used to smoke, but it might be people who have irritants from the environment. And people have a lot of trouble breathing. And what happens is when they get a cold or the weather changes, they have these horrible exacerbations that often land them into the intensive care unit. And the morbidity and the mortality is incredibly high. And the challenge that we have in the clinical space is that they don't really present to care until they're not feeling well, right? So you get a fever, you start coughing more, and now you're already starting to go into this downward spiral. So then you show up into the emergency room, and the only choice we have is to kind of take you down that trajectory. So what we're building at Zeph is a kind of longitudinal monitoring system, and we're embedding cough detection So what we'll be able to do is understand at a very granular and fine level how your health is changing over time, with the idea that we can detect your exacerbation way before than we can clinically right now, and ultimately intervene so that you don't end up in that trajectory. So this is something that it just seems really amazing to me. I think for a lot of other conditions, we've been able to intervene early, and for COPD, we just haven't gotten there yet. So I'm really excited about it.
So we have your immune system, we have chronic illnesses that we can solve, we have designing for behavior change. What advances are happening in this space with AI? Just to sort of, I'm going to get into more specifics, but just sort of broadly and jump in as you wish. But like, where are the advances right now for changing behavior using AI?
I think for a long time, coaching as a mechanism to move someone through kind of like a sustainable change in their behavior and unlocking a new habit has been in a very effective way, but it's also incredibly hard to scale. And so I think what AI is enabling us to do now is think about how we can start to scale some of these coaching services more effectively. But it isn't just the scaling component, it's about how the coaching component can become more dynamic and adaptable to individuals. And that's really where I think the kind of the power in what AI is able to deliver now is starting to kind of is starting to come to fruition. And it's incredibly exciting. Along with that, you have the option of being able to present adaptable goals. Building a new behavior often requires a goal that you sign up to. And the AI can predict how we can start to change these goals. A really simple example might be the number of steps that you're working towards. Traditionally, in old kind of product design and systems, you would have keyed in the number of steps that you wanted to be able to meet on a weekly, monthly basis. And it's quite arduous. It takes a lot of time and energy for someone to be able to facilitate that type of activity in a digital service. And actually, I think what AI is going to enable us to do is to be more predictive in this space. It's taking some of the burden away from a process of changing behavior, which is already incredibly difficult. I'm sure everybody in this room can vouch for how hard it is to change a habit.
Especially in January when we've all put in holiday pounds.
Yes, yes.
Or February. Hi, Shikha, you've looked at these products, you've been in policy, you've been trying to help people improve their health through digital transformation. What do you see with AI? Like, where do you get really excited? Because as we were saying, it was only 2 years ago that ChatGPT came out. Now, some people in this room knew about these things long ago, but the public only found out 2 years ago that you could put something into ChatGPT, your blood test, and it could tell you a few things.
Absolutely. So completely agree on the personalization side. We know in healthcare, cultural concordance between a provider and a patient improves outcomes, and that's a lot about the communication and understanding each other. And so I think very similarly, really understanding and being able to mimic what's in coaching or what's in a therapeutic relationship with a clinician by really understanding the person and understanding their motivations is incredibly important. Context is really important in behavior change. Really early in my career, I designed a fruit and vegetable prescription program. And so, for low-income families that were struggling with having healthy foods. If you don't know what's accessible to a person, you'll recommend things that aren't available to them all day long. And we certainly do this clinically all the time. So, I think really knowing, where someone lives, what their neighborhood looks like, what their zip code is. I mean, we've struggled with those things I've been out of med school for like 25 years now. So in my early days, we used to have these crazy binders of like all the different resources and what's available. And, that's impossible. Things change all the time. So I really think that we can kind of both think about the right way to communicate with someone, what their true kind of inner why is, like why do they want to change, which ends up being incredibly important for behavior change. And then the context I don't know how to say that sentence, but the context that they're trying to make that change in becomes incredibly important in terms of how they change behavior. And AI, those are really complex decisions when you weave all that together, and AI can really help with that.
Scale. Lynnette, with Omniscope, you're focused on the immune system. We've seen this, I remember being in Boston, I've lived here 25 years now, but I remember in the early days of being here, they, Lander invented or discovered the human genome. We've seen George Church come along with CRISPR and gene editing. Cambridge and Boston has been this amazing forefront of this healthcare space. You're talking about working at the cellular level of therapy. How does large data help you do that? What are we really going to solve at the cellular level that's new and different? Because we were all so excited we could read our genome. We did 23andMe. Some of us did, spit in the tube. When we were talking to Vijay this week too, your co-founder, it's talking about this whole cellular level. Yeah. What does that mean? And how does data help you get to the cellular level?
I think building on the question before too with data, its scale is important, I agree, and also reach. And I think what's really important too is the quality and how clean and good your data is. So when it comes to the cellular level, you're looking at single cell, right? How the cells transfers into medicine, personalized medicine for us all. So I think with CRISPR, it's really brought us to a whole other level. But I think today with cellular therapy, that is the answer going forward. But the problem is only 20% of immunotherapy works, right? And we're not able to tell why and how much we're supposed to be giving everybody.
Realize that.
Yeah, 20%. Only 20%. And these are very expensive and very time-consuming treatments, right? So we need a better way of looking at data, a better way of delivering these treatments, a better way of monitoring, a better way of saying, hey, are you responding? Are you not responding? And I think that's where the beauty of good cellular data comes from.
So how do you get good cellular data? Is it just a big, large scientific data bank of everybody's T cells so you can sort of cross-reference? Like, do you need a lot of these to be able to get to the answers that you need?
Well, I think a good example is for the average human, we've got about 10 to the power of 13 different unique T cells circulating in our adaptive system, right? A bit of a science lesson here, bear with me. I'm not a scientist, so I've botched this up. I'm sorry, my co-founder. But every T cell meets an antibody and they lock because they recognize each other. For example, a COVID cell and in your COVID-specific T cell. And what happens is this T cell proliferates, it clones itself, it sort of becomes an army. Now you've got 10 to the power of 13 unique T cells in your body. So meaning if you don't capture enough of that, you're not going to get that resolution coming in. And today's state of art captures about 10 to the power of 3, I believe, amount of T cells. So that's not a lot. 10 power of 3? No, less. 10,000 T cells per sample. We capture 1 million T cells a sample. So with that, you don't just get, you get skill, but because of that skill, you get definition, right? So I'm able to see, hey, I've got a COVID vaccine coming into my body, and then, are those T cells still expanded? Is the army still there? Are they still working? After 6 months, that's come down. Okay, the army is probably tired or it's not there anymore. This is where my booster shots come in.
Fascinating. Greig, you told me on our pre-call that you love to solve, quote, a gnarly problem.
Yeah.
You said gnarly. I think we're all drinking. Very hilarious call because everybody on the call was drinking Yorkshire Gold tea, but we were in Vermont, Yorkshire, and Barcelona. I think Shikha was the only one that didn't have the Assam. But we talked about gnarly problems, and you said you actually have a process, and I've been on your website, and ustwo explains the process, but can you explain the process? Like, if you're one of these, I know you have lots of companies, not just in healthcare, that you solve these problems for digitally, but what is your process at ustwo so people can understand?
Yeah, I mean, ustwo, we are human-centered. So whatever kind of like challenge or space that we're working in, we will spend an awful lot of time understanding who our core audience is.
And we'll leverage different types of research methodologies to be able to do this.
But I'd say kind of the broad process is human-centered design, kind of also balanced with a pragmatic product-led approach.
Which is using agile principles to be able to deliver products nimbly into market as fast as possible.
But the user is kind of like a central part of that process, and they remain a central part of that process all of the way through to delivering a product.
It's funny because you and I talked about it earlier. People may not know this, but ustwo built Monument Valley, the game, and we've done much more since that now in the space, whether it's with energy companies, whether you and I have talked about some media companies you're working with that I'm very excited about. But one of the things that you helped me realize, and the Brits between Shakespeare and Harry Potter are good at, is building narrative. So how does a little plug for the Brits, since the British Consulate's hosting this tonight. You are good storytellers. Americans are bad, but you do have that. And you said to me that that's a core piece of when you're building these models and products. Can you talk to us a little bit about narrative building?
Yeah, I mean, particularly, so us two, we created the game Monument Valley, which it was a huge success, and Monument Valley 2 and Monument Valley 3 has subsequently kind of like been launched, and we work very closely with Netflix and also Apple Arcade, where we've got we've got relationships with both of these. And both in design and also in game design, the narrative is crucial. Like how you lead someone through an experience is a really, really important consideration to take. And that narrative comes from not just your tone of voice, but also how the brand is represented inside the product as well. This is all part of the storytelling toolkit. And when you move over into game design, it all starts off with the narrative. You think of the narrative and then you build the worlds around the narrative, and the characters start to take shape around that as well. So storytelling is a really central part and role that we use in a lot of the work that we do at ustwo.
I'm going to pull you and Shikha in on this one together. Just understanding that how AI allows you to personalize things, and you can design for consumer adoption. But where are you seeing consumers change their behavior, and how do you make sure they stick with these habits? Like what's the sweet spot to sort of keeping them engaged versus falling back to maybe an analog method? So whether it's COPD, or whether it's taking medication time, or whether it's doing your health exercises with the kids. With the YouTuber, I'm forgetting his name now.
Joe Wicks.
Joe Wicks. So, how do you keep people coming back to do this? We have other people in the room, whether it's Whoop or, more wearables. Just how are you seeing people stick to it? What behavioral change are you seeing that's allowing you to keep people coming back?
I think you need to give people options, both at the outset and then on an ongoing basis. So different people are quite obviously motivated by different things. So some people care a whole lot about what other people see or think about them, and they might be really excited by a leaderboard. Other people just want to hide when they're making a little bit of progress, and where they could only walk 100 yards last week and now they can walk 200 yards. They may not want to share that with the world. So certainly in a lot of the products I've worked on, we really think about gamifying in multiple different ways and personalizing and thinking about doing really deep user research. Starting with the critical things that seem to gel this community. So in COPD, what I'm working on now, a lot of people suffer from social isolation, right? They can't breathe well, they have oxygen tanks, they don't like to go to the grocery store because they have to bring their oxygen tank and people look at them. And so they're really isolated. And so building community is the first thing that we tackled in building this product. And then we think about the other things to layer on top of that. So the community ends up being the cornerstone of this particular product.
So if you're a Zeph user, you have a community that you're tapping into?
That's right. You do you do telemedicine type of rehabilitation. So you do exercise with a group a couple of times a week. And that connection with your therapist and with your other participants ends up being the anchor for most of our patients. They're really excited about that time that they spend together.
How much data, Lynnette, leaning into you on this one too, how much data do you need to be able to start to personalize or to be able to have a clinical trial work? Like what data, for those of us like myself, don't know about this space, how much data do you guys need to be able to start to really personalize and have this kind of large scale effect, like scale?
My goodness, a lot. I think it's not so much how much data, it's the sort of data, right? It needs to be personalized, and it needs to belong to you, and then it needs to be at scale. You can take data from the public data sets, they certainly are, but they tend to be noisy, they tend to be terribly annotated. It's not very uniform, and there's not a lot out there. So I think for us, it's really because of the resolution that we get, because of the number of cells that we get. It's proprietary chemistry that we're able to process with. It's a proprietary AI that we put that through. You do need a lot of data. You do need a lot of good, clean, quality data.
A specific person's data. So it's not like a little bit from lots of people.
Yeah.
Would you rather deep data on a smaller set than a little bit of data from a larger set?
I think diversity is important, right? So it's important, both are important. You need the deep and then you need the broad, because that's how you compare, right? And that's how you say our partnership with Barca gives us exactly that. You've got the elites. I don't know if there are any Football Club Barcelona fans here. You've got the elites, right? Setting the example, setting the goal of what, you know, a very healthy human looks like, what a very healthy data set looks like. What does this person look like when they're inflamed and then when they're coming back to normal, you know, longitudinally tracking them.
So with the Barcelona football player, are you sharing that data with the public on his health?
I think some of that may be proprietary.
Proprietary.
But it allows us to learn what a healthy response looks like.
Because that's your Olympian model.
Exactly.
How much data do you need, Greig, to be able to do the things that you're doing?
Well, the thing is, often the space that we're working in, we're working on a product that is the very beginning of the kind of its inception.
So we have limited data that we're playing with at the beginning, which is why it's really important that we lean into certain frameworks that we then work to be able to get the effective products out into market, well, because then we start capturing data. And some of those frameworks that we're often considering, at ustwo, we kind of follow something called the COMDI model, which is the behavioral change framework. I think it's a framework that translates really easily down into design. So it talks about capability,
your opportunity, and then the motivation. And so the capability is someone psychologically and physically capable of enacting this new behavior that you're suggesting. Opportunity goes back to the environment. If you're asking someone to attend a gym, is a gym within close proximity to them? Can they afford a gym membership? And then you've got the motivation, which is talking about how you've got being able to kind of balance the
idea of intrinsic and intrinsic motivation. So we use these frameworks to start mapping out what the suggested service would be. And then we launch it, and then we start to analyze
the products that are live in market through longitudinal testing, because everybody's journey when it comes to behavior change is very, very different. It is an absolute misnomer that it takes 21 days to change a habit. That is not true. And actually, that story, interestingly, comes back from the kind of 1980s, where there was a plastic surgeon that was suggesting that that was the length of time that it took for someone to start to recognize a new part of their body. And then the whole of the community jumped onto the back of this. It is factually incorrect. It takes a long time, and it's a very personalized journey. And so getting a product out into market, monitoring it longitudinally so that you can start to optimize and see how your different audiences are kind of using it is the kind of our goal that we aim for. And then often at ustwo, we work very closely with the organizations and businesses that we're building the products for. We hand the product over to them, and then their teams continue to nurture, grow, and scale these products into their businesses and organizations.
I'm just kind of blown away by how we can change the whole way that we do healthcare. You know, the UK has set themselves up to be a leader in AI safety. They held the first global AI summit in 2023. Everyone knows that America is the one who's going to be the least regulated
fastest to market, and the UK is definitely committed to an innovative market, less regulation, with some AI safety. But how are you guys looking at how you can change the healthcare industry safely, quickly? Where is that balance? Because you know what you can do if, you know, the traditional medicine gets out of the way. Insurance companies start to turn the money over to you. Just how do you balance that out? The safety of the AI model while also scaling quickly.
The safety in AI is a really interesting question right now in hospitals around the country. AI for note-taking is rolling out en masse. I would imagine in about a year to a year and a half, almost every physician in the country or any type of provider will be using AI to take notes, because our process of both documenting and billing is so onerous that it adds another work day, for those of you who know or live with a physician, and adds a work day after the work day.
They're up till midnight doing notes.
None of us want to do that, and we have mass attrition, particularly in primary care. So, one way to solve that is to make note-taking much faster and make the billing automatic, which AI is a great use case for. So now we're coming into a place where almost every clinician encounter is recorded, and the data is at least part owned by a tech company. And so I think the cat's sort of out of the bag on safety in some regards, because you will have to opt out or opt into a system very shortly where there is no recording, there is no AI, because it makes our lives so much easier as clinicians that the adoption is just amazing. So I think in terms of safety, it's really being thoughtful on an individual level about what you want to share and what you don't. And perhaps that's a really pessimistic answer, but I think really thinking about your own safeguards, because I'm not sure that the safeguards are going to come as quickly as the technology will be adopted.
So it's not like you can go to your doctor and tell them certain things that they're in confidence anymore. They are in public space.
Yeah, actually, your doctor is legally mandated to keep it in confidence.
Right, but they're not. It's a recording.
But the AI company that owns the recording is not. So your doctor can't talk about you in an elevator, right?
Right.
To another doctor.
Right.
But your AI company has yours. So we're coming into this really interesting moment.
Right. It is a really interesting moment. But we all want this change. We want to live longer. We want to live as a more healthy society. We want to find ways to get to disease early so we can be preventative. So where is that balance? And where's the promise that each of you is seeing in what you are doing with your products?
I think it's so important to just keep it patient-focused and, doctors-focused, and even with our product, we see it being applied recently to a 2-year-old. Babies, their immune systems are not fully formed yet. And this particular baby, she had a 0.5 kilo tumor in her body, right? And she was classified as stage 4, nothing much can be done for her. We were able to use our technology to track the treatment. And today, after 2 years, she's in remission. Right, so I think applications like that is very meaningful, but it's so important to always just keep it focused, patient-focused, doctor-focused.
And I guess if you're very sick, you stop caring about privacy because you just want a solution.
Yeah.
It's a very interesting tipping point. What areas of healthcare do you believe are the most promising for the investors and the insurance companies? Like, where are they willing to get involved? You guys can see what you can do and build, but where are the early industries for those of us that are wondering what will shift sort of the investment community? Where are the areas that people are interested? Is it in chronic, illness like you're seeing, or is it in early testing of T cells that you're seeing? Greig, what are you seeing? You have the clients coming to you. Maybe if each of you could just talk about that, where you see this sort of tipping point for the investor community, where they're excited.
Yeah, from where I sit, I think we're not quite there. I think we had a big surge of investment in condition management, and a lot of the really exciting products didn't deliver what people had hoped they would. And so a lot of investors and payers are kind of
Why didn't
down.
they deliver?
I think the personalization wasn't there in many cases. In some cases, and in some cases, the technology wasn't there. Longitudinal monitoring is hard, right? If you give a patient a blood pressure cuff and you send them home, and tell them to just take their blood pressure, the percentage of people that does it is typically sub 20%. Right, so on a longitudinal basis, right, and on a regular basis. So, I mean, as we've said, behavior change is hard. So, you really need a sticky solution and a personalized solution that takes into account some type of framework around real behavior change. And many of the things that are out there don't actually do that. So I think we are near another tipping point where AI will unlock that for us. And this mass personalization that we're talking about will really come to fruition. But I haven't seen as much on that. Where I've seen a lot of excitement on the investment side is really in operational efficiency, relating to what I just said before. The process, particularly, this is much more of a US-centric problem, but the process of seeing a patient is 70% paperwork and 30% actual diagnosis, relationship building, and management, which is what should be the entire visit, at least in my view. And so I think we're seeing a lot of investments into everything from how do you make prior authorization go faster, to how do you determine what plan someone's on, to how do you know what billing code to use and how much time the clinician actually spent.
Right, which Athena Health, which was one of these IPOs, Jonathan Bush, that was of this area. And I know he's been looking a lot at filing. And so you're seeing the efficiencies as the attraction, but you started Zeph. So you obviously believe in being able to take care of chronic care. And so is that the insurance companies who are behind you to make sure that's happening? Is it the pharma companies? Because at the end of the day, none of these startups happen without investment. And so that's, I guess, my question is where is the investment community or the insurance community excited to see us to build Zeph, us to build Omniscope? What are they excited about?
Yeah, so I mean, the insurance company is always excited about cost savings. And so the population that we work with has a really high rate of admission and has a really high medical spend, typically, $3,000 on average per patient per year, just of unplanned care, unnecessary care. And that's the mean, right? Some of those are in the tens or the hundreds of thousands of dollars. People get admitted month after month. So I think there's a lot of excitement around how do we know when someone's getting sick and keep them out of the hospital.
And Greig, how are you changing behavior for that group? Because hear this again and again in healthcare, that it's the same group that is costing the system the money. You obviously understand narrative and behavioral change. What are you seeing, and are you feeling hopeful and you're seeing some success rates in those spaces?
I think so. I mean, when we're designing products for trying to enact and change someone's behavior, simplicity really always has to be kind of at the core of it so that we can attract as broad an audience as possible. And that requires leaning into frameworks that have been proven to be successful in the past. Another one that we often think about is how do you make it doable, how do you make it tunable, and how do you make it renewable for a product? And that's how do you make it doable? How do you make it tunable? How do you make it renewable?
And renewable.
And this is just a really kind of simple way of how do you strip out these services and deliver something that is just trying to deliver one thing really, really well, because we are all bombarded by services continually. And so doable, make sure there's a low barrier to entry so that we can address as large an audience as possible. Tunable then plays into the whole idea of the AI piece. We need to make sure that it's as hyper-personal, as personalized as possible for individuals so it feels relevant for them and we can be guiding them through their journey. And renewable, we've got to give people a reason to come back to these services so that they can actually stick to a habit. It's all very well and good being able to kind of hopefully change someone's behavior, but it's also very easy to drop off the bandwagon as well. And so our services need to be able to cater for that, to bring them back in as well.
And is through the mobile phone, is that the fastest way to get to everyone, or is it going through wearables now? Where do you see that shift? How much longer is everything happening through that Android or iPhone?
I mean, I think wearables is increasingly becoming a really, really important aspect of being able to monitor and pick up essential healthcare data that then forms part of the story and forms part of the narrative to help someone start to move towards changing what their desired behavior is. So wearables, they're getting smaller, they're getting more advanced, and this is the space that we will continue to see to grow. Often wearables need to be partnered with a mobile phone.
And so mobile phones are still going to remain part of that ecosystem. But when we do design digital services, us two, it is very much through the lens of wearables
and mobile phones. And you know what's great about that? Is that it actually gets you to focus on what is essential to be engaging with the user. Back in the day when you had large desktop screens and you could kind of deliver every possible feature in front of them, that's just complex and unnecessary.
Right.
And with generative AI, we can start to predict and we can start to provide UIs that are actually dynamically changing. Why do we need to show everyone everything all at once when we can just show them the one thing that is important for them at that moment in their journey?
Do you have categories now? Are there sort of like 5 types of people? Like, you're going to give us all like monikers soon? You go into this category.
No.
You're the achiever,
No,
or like you're the couch potato. Like, do you have certain like categories, or
You
is it?
see, this kind of, in human-centered design, about 20 years ago, it was all about a persona. So you were designing around a persona. They have kind of fallen out of fashion, and rightly so, because they're quite an old type of design instrument. We think about archetypes now often.
Okay.
And so an archetype is less about an individual's hobbies and interests and where they live and what they do for a job, etc. It's more about what are the behaviors that individual kind of portrays or conveys. And so often at the beginning of projects, we will start to map out the archetypes of the people that will be using this service. And then these behaviors and these value drivers that we're designing towards are what we'll be considering through our design process. So the personas are the dead, the archetypes are the instruments.
Do you name those? Do they get a name? Is there an avatar for each one inside the office?
The naming is
You're like,
fun.
oh, there's one of those again.
Yeah.
Talk to me with Omniscope about how you're going to get people to be giving you their T cells and gathering that data. At what stage of the journey are you at this point?
Well, we've got our product. Right now, we're focusing on a partnership with Barca. So that's where we're starting, because I think, again, establishing what the healthy cohort looks like, right? And then, I think when we were speaking with us too, one of the things that they told us too, well, it's not a health management platform. It's an investment management platform, because at the end of the day, you're a club, and these athletes, they cost a lot of resources, right? And you want to know what's happening with them, what's going on in the system. Are they going to perform at peak? Are they not really going to perform so well? I think that's where we are. And then once we've got that proof of concept, I would maybe not so proof of concept, but that's the first step. And then we'd love to bring that into the longevity space, where people are already, they already have bought into this idea that in order to live longer, better lives, you need to do certain actions and you need certain data, which are good, right? And then so then from there, I'd love to bring that into the clinics and the insurance companies, because if you think about it, with the insurance companies, you've got something called the critical illness list, which consists of about 40 to 50 illnesses. It's about the same for every insurance company, but more than 50% of that are immune-related diseases. So you've got one platform that's then able to give you data on more than 50% of that critical illness list. So then that's how we would love to bring healthcare and democratize it.
You guys talk a lot about the clean data that you want, less noisy data. How does data inform outcomes for your users? Like you want this data. What is it that allows this thing to get to the outcomes you want? I feel like you'd be answering this in some specific and personal to each person. But is there something that you really wish you were getting in data that you're not getting right now? Or is it just volume?
Well, when you go to the doctor today, and I'm sure we've known loved ones even, if there's something wrong with you, you go to the doctor and you pray that you get the right diagnosis, right? Or then you go to the second, you get a second opinion, a third opinion, and then you go for a treatment. You don't really know if it's working or if it's not, or if you're getting too much of it and it's going to cause an autoimmune, or if you're getting an adverse event, right? And that is the sort of data that we wish to bring to people, because we don't know what's happening today, really, on a cellular basis, right? And I think health at your fingertips is going to be so important. And it's not just that, it's multimodal too, right? With your wearables, with the phone. I think all of that needs to be a very holistic picture, which we're not getting today.
Do you think that your data is going to be able to be more predictive than doctors?
Predictive, yes. I mean, I don't...
Like if a doctor, we used to go to the doctor and they would check your blood pressure and your heart and look over your body and ask you how you were doing and you know, could tell you if they saw a problem. You might tell them you have an ache. Do you feel like that's like, is that already analog? Is like the data that you guys are able to get today going to be able to tell you faster than a doctor what's wrong?
I think those are slightly two different questions. So I would say, like, medically, we're not trained to be predictive at all. And people often ask how long, how much, or, you know, questions like that. And we frankly don't know the answer. We can give you a statistical answer, but that's not your answer. So, you know, if I'm to give you a diagnosis of cancer and you say, how long will I live? I can tell you, well, all people live this long. People your age and gender live this long, right? I'm giving you some
Markers.
statistical markers.
Right.
So I don't think we try to be predictive. I think AI can be much more predictive than doctors. I think if the question is, you know, are we beyond the era of asking the doctor what's wrong? I think people have already voted with their feet a little bit, but it's actually really dangerous because we know that AI isn't always accurate. So the big, you know, I mean, unfortunately, my husband and I are both doctors, and one of my children really loves Dr. Google. And so she has something, and she's at college, and she has something horrendously wrong with her every week. And my husband's an ENT, and she thinks she has tonsillitis like all the time, and she definitely doesn't. And now we just say like, yeah, you have tonsillitis. And so that's fine, it's benign, it's sort of funny. She goes to student health sometimes, whatever. But what happens if she thinks she has cancer every week and she goes and gets a biopsy, right? Like this is going to come and I mean, I think some of it's here already. So I mean, I hope we're not past the place where we really look at the scientific literature and we weigh that differently, whether it's either in our models and it's with our clinicians, but I think someone has to help you, very few people are really savvy readers of medical literature, right? And so if you're not that person, someone's got to help you navigate through. And I think AI probably is not, can be the right choice for that for a really long time.
I'm going to turn this over to the audience because there's lots of knowledgeable people in this space. But before I do that, I just want to ask each of you, because what I've starting to understand from this conversation is that what you can do now and what ustwo is doing is to change behavior. When people have chronic problems, you can change behavior. When you can design to help people understand what a healthy model is. And so when you look at this space, would each of you tell me what you're like the most excited about? Like where do you get up every day and say like, this is an incredible moment to be in this space in healthcare and AI? So if you could just tell us what the thing is that you're most excited about in your space right now.
For me, Omniscope exists because we're in this intersection of technology being there with the single cell and how defined it is, with AI coming in at the level that it is, and also with chips being, you know, much cheaper today. And to be able to be in this intersection is just amazing. I think we're at the cusp of what healthcare can really be. I think we're at the cusp of redesigning what healthcare should really look like.
What does that look like?
Personalized medicine.
Greig, thing that you're most excited about?
Absolutely, completely agree on that front. I think one of the things I'm most excited about, and I see my profession, like I love what I do. I love designing, crafting experiences that people love to use, that benefits them. But I also see it as a huge responsibility as well. Because all of these systems and services that are becoming increasingly more intelligent, they are going to do a better job than anything in the past has ever done when it comes to changing behavior. Now, we have a responsibility to make sure that the behavior and the societies that we're wanting to improve and to build are the right things. And so I'm so excited about the potential, particularly in the preventative care space. There is a huge amount of opportunity there for us to start to live healthier lives, be aided by technology that will then have enormous impact and benefit upstream in the healthcare system. And the technology that we have now is enabling that to happen. And that's the part that that is what I'm so excited about, because I can't tell you, I've spent the last 20 odd years just dreaming that we had the ability to be able to deliver this level of personalization on an individual level. And we can start doing that now.
Well, we expect you to be the gold star, because I think that's where people get overwhelmed by this. They want to make sure there's a gold star out there that's like, if this AI machine is going to change things upstream, are the people designing it? You know, do they have humanity in mind? I think you do. I think you do, Greig. I think you do.
Yeah.
Shikha, what are you most excited about?
I've been trying for a really long time to design for everyone. I told you about this fruit and vegetable prescription program that was like 25 years ago. And so the challenge is always, how do you get something for everyone funded, right? Things that the commercial answer is always, first you design for people with willingness to pay, and often they meet certain prototypes. And so I think in this moment, we can actually personalize at scale, and that allows us to properly design for everyone. And that means things that resonate with people really differently than ever before. And so I actually think we're going to get to much, much better outcomes with that, particularly in the people who are most disenfranchised.
Nice. As I said, I wrapped up with the UK consulate at the end of the year. But what I learned by spending time in another country's diplomatic corps is the power of countries working together. It's there's so much that we can all do together, even though we exist within our own nation states. And so I encourage us all to think about how we can work with other companies from other countries, because, you know, we're all humans designed the same way with the same cellular data. And I think we're on the cusp of a very, my dad says to me all the time, he's 86. He's like, you are living through the Renaissance. Like, this is the new Renaissance. So thank you, ustwo, for hosting us. Thank you, Michelle. Bishop and the entire British Consulate, Consul General David Clay's waiting for us up to this. And thank you to Amy and Alba Kilo. Thanks for all coming.